Hi, I'm Lorie Coates, BCBA with Davis School District.
I'm Joceline Ruiz, BCBA with Davis School District.
And I'm Krystal Martin, BCBA with Davis School District.
Welcome back to another episode of the Bait Debate, where our team of behavior analysts talk about behavior and share stories and strategies about responding to situations that might come up when working with students in schools. Today, we're talking about a hot topic, physical restraint. But before we jump in, we want to take a moment to pause and acknowledge that conversations about physical restraint can bring up strong emotions for families, students, and for staff. Our goal today is not to promote restraint, it's to talk honestly about safety, prevention, and ethical decision-making using principles aligned with SafetyCare, which is a curriculum that we use at Davis School District for managing challenging behavior. One thing that we also want to be really sure that we point out is that restraint should be the absolute last resort that we use when working with students and should only be used when safety is compromised and there is a risk of imminent harm either to the student or to others around. All right, so let's jump into our questions. Lorie, can you tell us about what is restraint and what it is not?
Yes. So very important to understand the difference between when we say restraint versus helping or guiding a student. So restraint is actual immobilizing of the student for a temporary immobilization for safety. Whereas you might guide a student, like, putting your arm around them, guiding them to another location. As long as you're not immobilizing, it's not restraint. It's just guiding and supporting students. So I think that's important for us to have that distinction. Mm-hmm. And restraint is not a behavioral strategy. So as we've talked a lot in our podcast, we talk a lot about behavioral strategies. It's not a strategy, and it's not a consequence. It's not like, this student did something wrong, so we're going to restrain them. It's never about force or control. It's only about safety, and only when there's no other safe alternative. There are so many risks involved with restraint, and we'll talk more about those a little bit later. But the important part is to realize that the risks are for both parties, whether that be the person being restrained or the person not being restrained, or person doing the restraining. If there's no imminent danger, restraint shouldn't happen. We'll probably say that several times today. It's about protection, not control. Krystal, how can schools ensure they're protecting students' rights while maintaining safety for everyone?
Yeah, I think that kind of the first thing I think of is the school should have a clear procedure, kind of guidelines in place. So we've mentioned our school uses the SafetyCare curriculum for responding to challenging behaviors. It teaches about using restraints if necessary when we may consider using them. Something that I think is the strongest message that I would take from SafetyCare when we're training, we really try to point this out, is that most of the crises are going to be preventable. We want to think about that prevention, and it doesn't have to be something big or flashy. It's going to be building relationships, having consistent routines, and looking for those early signs of escalation, kind of recognizing those signals. I was just out at a school today, and I was talking about that idea of recognizing signals, and the teachers were asking me, well, how? And I said, well, let's think about what are we seeing right before they became aggressive? What did the students show? And it's looking for patterns, because sometimes they feel that it comes out of nowhere, it happens suddenly. So you got to think of what patterns you're seeing. And some students, they may start getting silly, a little extra silly, or they may start refusing to follow some simple directions that normally they follow. If they've taken a break and they're slower to get back, they just seem dysregulated, that may be a signal to look for. And that's when a time that you can intervene and see if there's things that you can do to prevent it from becoming something more.
Or not intervene sometimes.
Or not
too,
intervene.
right?
Yeah, and that's something that kind of my next thought was something we talk a lot about on our podcast is co-regulation. And thinking of, what are the adults? How is the adult regulating themselves? And how can they support and model regulation? And so as I was thinking about what this is, you want to model calm behavior and use a calm, neutral tone, or sometimes not say anything at all. Thinking about another student that I had observed, the student was dysregulated and escalated to where they ended up under a table, tipping chairs over. And I recognized that any prompting we gave, the student was just going to either try to hit us or spit at us. And so I just stopped. I was near, but I just waited. And it didn't take that long until the student said, "I'm ready now." And that gave me clues of, what do we need to teach so it doesn't become that escalation? How do we prevent? And so now we're going to think of skills of how to request a break or something. But I think looking for those.
Like I say,
Yeah.
above all, teach. What are we teaching?
Yes.
So as we watch, we can see those skills that we need to teach.
Yeah. There's other preventative strategies. We can think about what the environment looks like. How can we reduce triggers from happening or remove them completely if possible? So there's a lot of things for that prevention.
For sure.
But if we can have that prevention, that's going to help a lot. Joceline, when do we know when a restraint is and is not appropriate?
So during these situations, everybody is escalated. Staff are required to make decisions fast, and they need to make them pretty quickly. So we always have to come back to the question of, is there an immediate risk of serious physical harm to the student or to others in the area? So some of the things that we need to be considering and looking at is having a continuous risk assessment. And this isn't a one-time decision. We need to be considering risk moment by moment. And things that we can look for when we're doing this continuous risk assessment is looking at the changes in the student's behavior. So like Krystal said, is the student escalating when we're trying to intervene? Is their behavior are they getting more agitated? So then this is a sign for us that, okay, maybe we need to step back. And then when we do step back, do we see that student's behavior starting to become more regulated? If that student is becoming more regulated, it's probably not appropriate to intervene with physical restraint. We can also scan for environmental factors. So are there objects in the area or people that would be vulnerable if there was something that happened? Do we need to remove some items? Maybe that's how we can make the situation safer, is by having less people around, having less objects that can be used dangerously around. And then also considering if using less intrusive interventions is effective. Maybe we just need to step back for a moment and wait instead of intervening with a physical restraint, because if we do intervene, that also could potentially escalate the situation more.
When I think about waiting, and we talk about this in our trainings a lot, is it's not convenient. We can't rush waiting. And so it may take a long time, but it may lead to calmer.
Yeah. But there might be situations where it is going to be appropriate to implement a restraint for safety. And we also need to, as soon as we make that decision to implement restraint, we also need to be thinking about ending restraint as soon as safety returns. So some things that we need to look at is if we can step back safely, should we? And we probably should, so that we avoid putting our hands on students. And if restraint is the alternative that is appropriate, then making sure that we're thinking about ending restraint as soon as we can when the situation has become safer. What are some ethical considerations and risks to think about when using restraints?
Well, as I talked about earlier, restraint carries so many risks. I can't list them all here, but we think about the physical and emotional risks that restraint carries. You often worry about the injury that can happen to you performing the restraint or to the child. Lots of different physical injuries that could occur. And as we know from, and I hate to be like super, down about this point, but I think it's a really critical point for us to remember is we've seen in media postings and things of that nature how restraint can lead to death if we're not cautious about how we're implementing those things. There's also emotional risks such as relationships lost, dignity lost, reinstitution of trauma if a student has a trauma history of being restrained or secluded. All of those things can be, they're so important. We can't stress that enough, that physical restraint is a very risky procedure. Because it has all those risks, I think that's where the ethical considerations, training, and oversight really come in. So for instance, in our district, you've already mentioned that we use SafetyCare. Anyone who performs a restraint is trained in SafetyCare management techniques, so they know how to do it correctly and the most safe way possible. And then we also review all of those cases. So for those of you that aren't aware or aren't familiar with our Davis District procedures, there's a committee in our district that looks at every one of these restraints that occurs and evaluates whether it was necessary, what other training needs to come for the teachers or staff that was involved. And so I think that oversight becomes really critical when we talk about using restraint in our district. The last thing, just really important to remember, going back to what you said just a minute ago, Jocelyn, is that ethical practice would include constantly working to fade restraint, right? How would I get away from that? What's my continuous risk assessment once I've instigated the restraint, right? How risky is this? Have I moved weapons out of the way so now I can go ahead and release the student? Just really thinking about that constant risk assessment. Krystal, what happens after a restraint has been implemented for a student?
I think an important reminder is that what happens after is just as important as what happens during. And we call that debriefing. And so that is going to give time for the student staff to recover, to learn, and to repair relationships. A time for debriefing is not going to be a punishment. Mm-hmm. I think the goal or focus should be about preventing the next crisis. So if you're able to debrief with a student, that should happen when the student is calm, willing and able to have a discussion, whether it's big or small. I don't think it has to be a grand discussion. Something. And then I also think that the staff should debrief with each other, talk about the whole scenario. And we've talked about, this may happen the next day. They may not be ready that day to talk about it, but maybe the next day. But I think that they should talk about what happened before, what happened during, after, and focus on how can they prevent it again. Kind of going back, I already talked about prevention, but we always want to see what we can do to prevent it. And as you were kind of mentioning, if we do get to the point of using that physical restraint, that is very stressful. It's, maybe scary. And so debriefing will allow for those relationships to repair between staff and students, because we're going to continue working with those students.
Yeah.
And having that time to build those relationships and trust again is going to be really important. It helps it so that it can validate the students' feelings, but we're not going to validate the behaviors that they are engaging in, but just recognize their feelings. Kind of thinking about our discussion, if we were to think about what the learners can take from what we've talked about today about physical restraints, what do you think that would be?
Well, we've already mentioned this multiple times here in this podcast, but this is the most important thing that you need to take away from it, is that safety is a top priority, and restraints should only be used when there is no other safe alternative.
100%.
Yeah, we need to, like Krystal mentioned, prevention is the work. So how can we prevent it from getting to a situation where we need restraint, and then only using it when safety is compromised.
Agreed, 100%. Well, thank you today for tuning in to the Bait Debate podcast and talking about such a very sensitive issue of restraint in schools. Definitely something that's important for everyone to be aware of, the risks that are involved, the safety that is needed, the relationships, the prevention, how do we stay away from restraints if we possibly can. Such a critical and sensitive topic for right now. We appreciate you joining us again, and we appreciate you following us and tuning in to all of our podcasts on all the different social media. We have many more topics to cover throughout the year to keep you and your educator friends reeled in. So we'll catch you next time.